Hello, so this is my interview video for VetClin Management. So I'm going to start by introducing myself. My name is Emma Georges, and I started out in the veterinary science field. When I was actually 14, I started working at a cat shelter called All About Spay and Neuter, and I started working with the animals and doing husbandry and things like that. And that's what really inspired me to get into the veterinary science field. And from there, I went to BOCES for 11th and 12th grade. And it was in a specific one that you needed an 80 on one of your science exams to get into. And we talked about all things from anatomy to husbandry to diseases to dog breeds, all of that kind of stuff. And it started me on learning about fields like veterinary technology, which is what I ended up doing. And my teacher talked a lot about SUNY Delhi, so I ended up coming here to SUNY Delhi to start my degree. And I'm currently in SUNY Delhi, and I will be graduating this year in the spring of 2021 with an associate's in veterinary science, and then I'm going to be working on getting my licensing. Other licenses I have are wildlife, because my BOCES teacher took us to do wildlife, so I'm certified in that. And yeah, I'm really interested in doing some small animal practice before I move on to try other things. I'm also interested in emergency medicine and all things like that, and also conservation. I think that would be a really cool thing to try out. So I also have done a few internships. I interned at Massapequa Pet Vet for a little bit in 12th grade. There I did some regular things, like we assisted with surgeries, we cleaned up after dentals, we did laundry, we held legs and stuff for doctors when they were surgically scrubbing, and I also cleaned instruments. And then for SUNY Delhi, I had to do a preceptorship, so I did that at Banfield, and I did a 240-hour preceptorship there at the Levittown Banfield, and there I learned so much. I did urinary catheterization, injections, drew blood, held patients for exams, talked to clients, discharged patients, took patients in, and all kinds of normal veterinary things, and I really enjoyed that and would like to do that again. So yeah, that's the basics of introducing myself and my process in the veterinary science career. Now I'm going to get into the questions. So my first question is, where do I see myself in 5 years? I think in 5 years I'd like to be working in a small practice somewhere, really honing in on my skills and getting really strong in them and being a competent tech who knows what they're doing and has really mastered those more basic skills like anesthesia and injections and drawing blood, and like really getting good at doing all of that stuff, as it's hard when you're in school. You don't really have much of an opportunity to do them, and I'd like to get back onto that process. I'd like to be pretty comfortable wherever I am, a tech people know who's strong at their job and good at what they do, and have some kind of relationship with the other techs and the doctors there, and be in a place that's really comfortable and no one really feels oh, I can't approach someone because they're gonna freak out on me. So I'd like to be in a place that's comfortable. I think that's a good thing to be ensure that you have. My next question I'm gonna answer is about if there's a conflict, the question was about if you have a conflict with someone, they gave a dog the wrong medication, and what should you tell them? So what I would do is I would talk to them first, obviously. I'd be like, we really can't just ignore this. We need to tell the doctor. They're not going to get mad. It was a mistake, but we need to tell the doctor because this patient could be allergic to this medication or could have some kind of condition that contraindicated in this patient, and we are not equipped to deal with that. We don't know what we're supposed to do. So I would be like, we need to tell the doctor. And I'd be like, if you don't tell the doctor, I will. And now I know that could be confrontational with the person, but I feel like it's something like you have to pick the patient over people. And I really would try and convince that person to go to them and be like, we have to care about the patient. That's our job. That's what we signed up for. So we really need to work to make sure that that patient's okay and safe. And we really can't just mess around with it. Like, it needs to happen. We need to ensure that this patient is getting the care that they need. And I'm hoping that I could get through to that person. And, afterwards, after the issue's resolved, I could always talk to them and be like, hey, I'm sorry I had to do that. If they don't do it, be like, hey, I'm sorry I had to do that. I'm sorry it went down like that. But I really need to ensure that the patient's okay. And then the last question I'm going to answer is, what would you do if a client came to you and said that they could not afford a treatment and the best option is to euthanize? First, depending on what the situation was, depending on how sick the animal was, maybe I'd try and help them find another solution, like if there was some kind of other medication we could give, or like, some kind of at-home treatment that might work. But if the animal was honestly too sick to go home, too sick to avoid treatment, I'd have to get serious with them and be like, listen, we have to assess the quality of life here, and without this treatment, your dog is going to be suffering. And I know it's hard to think about putting them down, euthanizing them, but it's what's best for them, and there isn't any shame in it because you can't afford this treatment. It happens, things are hard to pay for. You can try and go through other options, like there's some online things that maybe could help you in paying for the animal, so we can try that. But the longer we let this go on, the sicker your animal's gonna get, and seeing your animal get really, really sick and seeing they're in pain and struggling is gonna be a very hard thing to go through. It's not pretty, and I think it's a good thing to be able to say goodbye in your own time, in a safe location where you're not going to just wake up one morning and they're going to be dead. Like, you are prepared for this. You come in knowing what's going to happen, and a lot of times that's a lot better. We have techs here who can comfort you. You can be with the doctor you want, and afterwards we can help you with the grieving process. If you don't want to be there when the final injection's given, that can happen. So it's just easier to do it. It's easier for you and better for the animal to do it this way. And I think I'd go with that for explaining it to them, that it's a better option. Like, not that we want to lose the pet, but it's easier if you are in a controlled environment. And maybe I'd talk about my own experience with losing my pet. Depending on the person, like, you have to assess how they're going to react to what you're saying. And like, if you think they'd like someone who relates to them, you could always be like, I lost a pet in, like they were an unexpected death, and it hits a lot harder than when you're expecting it, kind of thing. Like, talk about that, but like, it varies depending on the person and their reactions, and if you have a determined relationship with this person. If you don't, maybe send in a tech that does have a relationship with this person, like always sees them, things like that. But yeah, that's probably how I'd explain it to them. Okay, so those were my 3 questions. Thank you for taking the time to interview me today. I hope to hear from you soon, and I'm really excited about getting to work. I think it's gonna be great. Bye.